Hello, my name's Ashley. Our community project group presentation is on osteoporosis.
I'm LaShonda.
I'm Elizabeth.
I'm Sarah.
And I'm Jessica.
All right, we'll start our presentation. Osteoporosis, educating our communities on breaking free from osteoporosis. Osteoporosis is a common disease in the elderly and is characterized by decreased bone strength and quality. If left untreated, it can lead to fractures, decreased mobility, and costly treatment. Effective risk assessment as part of a thorough clinical evaluation is the key to detecting patients who have osteoporosis or those who are at risk for developing the disease. Our presentation is intended to show how to decrease the risk of developing osteoporosis, identifying signs and symptoms, and educate on treatments and facilities that help with managing osteoporosis. I'm going to turn it over to LaShonda.
Causes of osteoporosis is peak bone mass is reached in our early 20s. Much of it depends on how much bone mass was achieved during youth. Our bones are constantly being renewed. When we are young, the body makes new bone at a faster rate, while the old bone takes longer to break down. As we get older, this process changes. Older bone breaks down faster, and the new bone takes longer to replace, which means bone can become porous and weak. Family history. A person is more likely to get a bone fracture if their parents or siblings have had bone fractures. Vitamin D deficiency, and this can lead to the development of brittle bones and an increased fall risk, making osteoporosis worse. Calcium. This is needed to develop strong, dense bones. Being calcium deficient is a leading factor in the development of osteoporosis. Gender. Women are more likely to develop osteoporosis than men are. Women's bones are smaller and thinner, and the loss of protective estrogen when women enter menopause can cause bone loss. The symptoms are back pain that is usually chronic, bone fractures, usually of the wrist, hip, and spine, loss of height over time. Now I'm going to send you to Elizabeth.
Some risk factors for osteoporosis include the sex you are born. Females are at greater risk than males due to having higher estrogen levels and having them fluctuate throughout their lives. Your age, the older you get, the greater your risk. This is because of the change in speed of bone growth and breakdown. Your race, those of Asian descent and Caucasians are at the greatest risk of osteoporosis. Your family history, if you have a parent or sibling with osteoporosis, it puts you at a increased risk to develop the disease yourself. Your body frame size, men and women who have a small body frame have a higher risk simply because they have less of the bank of bone mass to draw from. If you have diseases affecting your mobility, like rheumatoid arthritis or ankylosing spondylitis, diseases that can affect absorption of nutrients, like inflammatory bowel disease, diseases that alter the regulation of your hormones produced by the body, like kidney disease, thyroid, parathyroid problems. Long-term use of steroids can also increase your odds, especially in this first 6 months of use. Taking large amounts of antacids, specifically those containing aluminum, can increase your odds. Complications that can arise from osteoporosis can include bone fractures. These are especially prevalent in your hip or spine. These are usually caused by a fall. It's the most serious complication you can get. They can lead to can increase your risk of death in the first year after a bone fracture injury. And spinal fractures, these can happen even without a fall. Bones become so weak that they crumple, and they cause pain, loss of height, and they cause you to stand in a hunched forward position. Here's Sarah.
All right, prevention of osteoporosis starts with good nutrition and regular exercise. Plenty of calcium and vitamin D are important. Supplements are available over the counter at places like Walmart, Walgreens. Protein is a building block of bone. Vegetarians and vegans may not get enough protein. Also, older population may not get enough protein for various reasons. These people may benefit from protein supplements. Body weight, being overweight or underweight may cause bone issues from the extra strain. Maintaining a healthy body weight is key. Exercise helps build strong bones. Start young and continue throughout life. Weight-bearing exercises can maintain and even increase bone density after diagnosis of osteoporosis. Lifestyle changes such as stopping smoking, minimizing alcohol intake, and decreasing caffeine intake can decrease your chances of getting osteoporosis and slow progression of symptoms. Alcohol causes the body to increase the amount of parathyroid hormone it produces, which takes calcium from bone, leads to increased cortisol levels, which can increase bone breakdown and decrease bone formation. And alcohol can also kill osteoblasts, which are the bone building cells. There's a direct correlation in smoking and low bone density. Women who smoke tend to start menopause earlier than non-smokers. Smoking increases the risk of fractures, and smokers tend to be thin and smaller built people who have less bone for the body to pull calcium from. With caffeine, findings are inconsistent, but there is a correlation between high caffeine consumption and smoking and or increased alcohol intake. Possible predisposition in elderly women that high caffeine intake increases cortisol levels. Jessica.
Okay, so the treatment of osteoporosis. So as we talked about prevention, treatment is the same thing. You want to definitely maintain a healthy, balanced diet with high calcium, high vitamin D. Also, they have talked about a diet rich in soy can also help women protect them from bone loss. Soy has estrogen, a estrogen-like hormone in it, and it does react the same way on the bones as estrogen. So some physical, you always want to do physical exercise. Weight-bearing activities like a brisk walk, climbing stairs, dancing, even step aerobics can definitely strengthen your bones and increase your density. Now, some exercises that improve balance and posture, like the standing hip flexor, you would actually go like this, put your arms up, and just thrust your hip forward, and it's super, super easy. And that little thing right there can help your balance. Standing on one foot like a flamingo, that can help your balance and also strengthen your bones as well. So strengthening and balance exercises can help build the bone and strengthen you. With better balance, you'll be more capable of avoiding falls and, in return, breaking that bone. So medications that prevent bone loss, estrogen. We talked about estrogen earlier. Estrogen plays a huge part in creating osteoblasts. Osteoblasts are the cells that actually create the bone. So it's super important to have that estrogen, especially later on in life. If you take a daily multivitamin, 2 parts calcium, 1 part magnesium, that can, or even just a vitamin that has added calcium or vitamin D in it would be really awesome. Vitamin D supplements actually help your body absorb the calcium that you're taking in to help build those stronger bones. Now we have SERMs, which is a selective estrogen receptor modulator, and this basically mimics this estrogen effect. So, it prevents the bone loss, it improves bone mineral density, it decreases risk of vertebral fracture. Some, SERMs would be ribofloxacin, which is Avesta, is the real name for it. Also, we have biophosphonates. They break down they slow the breakdown of the bone, so it maintains that bone density. Some of those prescriptions would be alendronate, which is Fosfomax, Minnesota, zolindric acid, which is Reclass, which is actually IV infusion, so that's actually an IV. Alendronate acid, which is Boniva, and resdronic acid, which is Actolone now. We also have our RANKL inhibitors. These bind to the receptor rank on the osteoclast precursor, controlling differentiation, proliferation, and survival of the osteoclast. An example of that would be dinsumab, which is Prolia, and that is a sub-Q injection that you get in your skin. You just get a little shot and you're good to go. We talked about the human parathyroid earlier. This is an anabolic bone building drug, and some hormones that you would take for this. This is really, when we talk about osteoporosis, we think of women, but this is also a disease that could affect men. Now, this parathyroid hormone, this is actually what we would, most of the time they give to men, and it's called teriparatide or Forteo, and we mostly see that again given to men. So at this point in time, specialists, if you think that you've been diagnosed with this, you would go see an orthopedic surgeon, a geriatrician, an endocrinologist, a physical therapist, a nutritionalist, even your PCP or your local OBGYN. So, on to Ashley.
So our community education aspect of this is, we would like to see more health fairs. We need to offer those open to the public with osteoporosis screenings. These screenings should consist of bone density testing and checking lab values. Educational pamphlets are very important. We feel like these should be given out at those health fairs and also presented to be placed at local doctor's offices, clinics, and businesses. Some of our community resources, we have the Batesville Aquatic Center. They have decreased rates for senior citizens. They offer various exercise classes, a lot of group exercise classes, including water aerobics, and they have a walking track. The Senior Citizen Center, they offer various exercise classes for groups. And then we have several fitness centers around town that offer personal trainers and group classes. Also equipment that you can work on individually on your own time, whenever's more convenient for you. And most of these fitness centers also offer decreased rates for senior citizens. And then we also have our public park, Fitzhugh Park, that offers a walking track with a beautiful view. And then these are just some of our resources that we use throughout our presentation. And at this point, does anyone have any questions?
No.
No? Okay. Thank you very much for listening to our presentation.